My name is Vicki Turner, and I'm going to give scenario number one for administration of an antibiotic through a secondary tubing. My patient is Mr. Shepard. He is a 72-year-old male. He was admitted with exacerbation of COPD. He does have a chronic tracheostomy, and he maintains at home with assistance from his family. My physician orders are to give the patient Rocephin 1 gram IV daily. The volume is 100 mils to be administered over 30 minutes, and my drop factor for the tubing is 10. It asked me to please calculate per minute the GTTs. So just to put that in, it's going to be 100 mils times the drop factor of 10 divided by the over the time of 30 minutes, which is going to make 33.3 GTTs per minute. I'm rounding that to 33 GTTs per minute. I must say that the pumps now is going to ask you for your volume and it's going to ask you for your rate. That is what I'm going to put into my pump today. So the first thing I'm going to do is I'm going to go ahead and verify my order, which is Rocephin 1 gram IV daily. It's going to Mr. Shepard. Pyxis, I will go to the Pyxis. Every Pyxis is different in every facility. In my Pyxis, I will put in Mr. Shepard's name. It will come up with his name, his birthday, and his room number. Once I hit the button on that, I will be pulling out my Rocephin. I will verify my Rocephin with my order. So it's going to be Rocephin 1 gram. My order says Rocephin 1 gram IV. So I have that. I'm going to make sure I have all of my supplies when I go in the room. A lot of times in different facilities, they have the medication computer that you can pull into the room, take into the room with you. So I'll take that in. I'll introduce myself to my patient. I will wash my hands. I will close the door to give him privacy, or the curtain to give him privacy. I will verify his name. He'll give me his name, his birthday. I will verify that with my MAR, as well as my order, and as well as his armband. Most hospitals have scanners, so I will scan his armband, which will come up on my computer, will give me his name, his birthday, and also his MAR. Once again, just to be sure, I'll verify the patient's name, verify my order, and verify that the MAR is correct. Once I do that, actually prior to that, I'm going to let the patient know that I'm going to administer some antibiotics to him today that the physician had ordered. I'm going to ask him if he has any allergies. Will he tell me if he has any medication allergies? Patient says he has no allergies. So I want to go ahead and get my things prepared. So I've washed my hands. I will probably wash them again. Place my gloves. Now I want to get my secondary tubing together. So I have my secondary tubing and I have my medications. Usually you will have it, you will work on your stand, but unfortunately I don't have a stand at this time, so we're just going to pretend that there's a stand here. So I have my medication. I'm going to go ahead and open that. My medication, my secondary tubing. Now, on my secondary tubing, there's going to be a blue little hanger in here. And that's going to be for the gravity for my primary, because my patient already has D5.5 running at 100 mils already. So this is what we're going to be using to bring the primary down for gravity purposes. And I'll just try to put that there. I don't want to tear up anything. Okay, so now I'm going to hook up my antibiotic and my secondary tubing. So I'm going to remove this blue part here. And then I'm going to remove this, making sure not to contaminate anything. I'm going to take the end, place it into my antibiotic with a twist and move. I'm going to close my clamp. because I don't want it to drain everywhere. I'm gonna hang this up here. If I can get it to stay. There we go. Once I got that, I'm gonna go ahead and make sure I have my IV and everything ready. My secondary, so I won't forget it. I'm gonna hang this down for gravity purposes. Okay, I'm gonna go ahead, I'm going to prime my secondary. Which I have to open that up. Open up my clamp. Sorry, too far. Okay, so once I do that, I apologize, I back up because I need to check my patient's IV. I'm not sure if I said that or not, but I'm going to check and make sure that the IV and everything is okay. Then I'm going to scrub the hub that's closer to the patient. I'm going to take off the tip of my secondary. I'm going to place it on here. Twist it. Make sure it is on there correctly. I'm going to make sure on my, like I said, on my my pump, I'm going to, the pumps that you generally have, you program them to, it's going to be 100 mils as my volume, and then my time expected is going to be 30 minutes because it's going to ask you that. All you want to do is make sure when you look at it that it is telling you what the rate needs to be, okay? Once you do that, I'm sorry, and I also need to put my label on my tubing so that my coworkers will know when it needs to be changed depending on the policy and procedures of your facility, okay? So once I've done my pump, I'm going to open up my clamp. I'm not sure if I told you this either, so I apologize if I didn't. On the pump, it's going to already be set on the primary rate. So I want to stop it and flip it over to the secondary rate, okay? And that's when you're going to put in your volume and your time. Once you've done that and everything is correct, you're going to open up your clamp. You're going to start your IV. You're going to make sure that everything is going fine. That's going to run for about 30 minutes. You let your patient know that you'll be back to check on them. Ask them if they're okay. They say yes, everything's fine. You'll come back in 30 minutes. Once you come back and the IV is finished, you're going to turn off your pump. Once you turn off your pump, you're going to clamp it. You're going to close your clamp. Yes, I'm sorry. Then you're going to undo your secondary. And there's usually some alcohol prep things that you can put on the end of the patient's IV, okay? There is a thing for this too, as well, okay? Then you can take your alcohol prepped cap and you can place it on your patient's, on the hub that you just took that off, okay? Then you can go ahead and you can bring your IV back up. You can check your pump, make sure your pump is off. You're going to take it back to primary. Once you take it back to primary, you want to make sure that you check the volume and the rate again, and then you'll turn your pump back on. Just make sure everything is running right, make sure everything is okay. Then you can return and start your documentation showing that you have documented your IV antibiotic in a timely manner.